6 months after Turp surgery, how's it going? What's the sex like? A frank discussion coming right up. Rob here with California Hike and Bike, and 6 months ago I had Turp surgery just before New Year's Eve, and I did a video that was the first 10 days post-surgery. If you're about to have a Turp surgery or you have one scheduled in the near future, make sure you go watch that video because there's a lot of good information in there. Many of you who did see the video asked me for a 6-month update, so here we are. So let's talk about the difficulty I had between days 30 and 60 post-surgery. And it wasn't the type of difficulty that you might think of. Actually, the difficulty I had was not lifting 20 pounds or more for a full 8 weeks after surgery. I'm in pretty decent shape, and 20 pounds is nothing. But what I did find out is when I did overdo it, I started to bleed a little bit. So when your doctor tells you 6 or 8 weeks, it depends on the type of surgery and how invasive the surgery is that you have to have. Make sure you stick to the doctor's orders. And it's not just lifting. About 6 weeks after my surgery, I did a pretty rigorous hike. It was about 3 miles with an 800-foot elevation change. And after I did that hike, not only did I feel it a little bit, down in the lower abdomen, but what I also experienced was, pink urine. So it created a little bit of bleeding again. Not a lot, but it was enough to notice, and kind of a notice to me to make sure to wait the full 8 weeks. Now I know what you guys are thinking. What about sex? How's it going? I'll get right to that in just a second, so stick around. Prior to the surgery, I was on 2 medications. One of them was alfusosin, and the other one was finasteride. They worked somewhat, but not only was I tired of taking it, because I had been doing that for the last 5 years, but it was also starting to not be as effective. I was getting up at night, having to pee, and I was just done. I was ready to have the surgery. And my doctor told me that for 3 months after surgery, post-surgery, he wanted me to continue on the meds. I never really got clarification on that. I forgot to ask. And I'm assuming it's because he wanted to make sure that the inflammation stayed down and just assist in the recovery period after the Turp. So I did that. I actually did it until I ran out, which is about 4 months. And after I stopped taking the medications, it actually, I didn't see any change. There was no change in my stream or, any other adverse effects from stopping the medication 4 months post-surgery. Okay, so here goes. Did it affect in any way the sexual function? Well, yes and no. If you've done your research and you're about to have this surgery or you're thinking about pulling the trigger, you want to research retrograde ejaculation. And basically what that is instead of coming out, it goes backwards into your bladder. And what I mean by that is after you've had sex, your semen just stays in your bladder, and you pee it out the next time you urinate. For me, it was an off and on thing. It really kind of depended on a lot of different things. Have you been drinking, or on any kind of meds that were depressants that, relaxed your muscles, for instance, a muscle relaxer, etc. What led up to your intercourse? If you just went right into it, you're not going to be as excited, and you might have 100% retrograde ejaculation. So for me, some came out, sometimes it was a little, actually a couple times it was none, But sometimes it was a lot, and when that happens, it was a heightened, explosion kind of thing. So you're probably going to experience, like me, different levels of the retrograde. So there you go. Other than that, didn't affect anything else as far as being able to perform. So yeah, no, it didn't affect me. So one interesting thing, which kind of surprised me, was up to about 4 months, if I had any kind of rigorous exercise or activity, hiking or lifting something, or drawn out lifting, or some sort of other strenuous activity, every once in a while I'd have a little flake of like a scab, and it was very, very tiny, but it was enough to notice when I peed it out into the toilet. So it didn't really affect me, didn't hurt. I didn't feel it. I just noticed it when I was looking down and saw it come out. So if that happens with you, it's probably not a big deal. If it's big or a lot, especially in the later months, in the first 2 months, it's just gonna happen a lot. But 2 months to 4 months, it happened very little, but it did happen. So I just wanted you to know that. After 4 months, it pretty much was back to normal. And when I say normal, I mean back to normal as a 16-year-old peeing. Strong stream, no starting and stopping. It all comes out, and when you're done, you're done. And it's awesome. So look, one other frank discussion we should have is, if you're not in good shape or in good health, as with any surgery, it's going to affect the outcome of this surgery and your recovery time and how you recover. So, all I can say is, if you're a little bit overweight or a lot overweight, my recommendation is probably, it's just logical to get in the best shape that you can for your post-surgery recovery. Because like this surgery and any other surgery, the better you are in shape and the better health you have, the better you are going to come along and recover, and the better you're going to feel afterwards. So listen, there you go. There you have it. My 6 months were pretty fantastic as far as recovery period and my experience with this surgery. I know there's a few out there, probably a small percentage, that have had some issues, and I feel for those guys, but statistically, you've got a good chance of a high success rate and a good recovery from this surgery. If you have not had the surgery yet, make sure you go to the description and click that link to see my first video, because there's a lot of good information on there on how to prepare for your Turp surgery. And if you don't watch it, trust me, you're not going to be as happy. If you do watch it, you're going to be really happy that you did. And the reason is because it gives you some good info on how to prepare. Okay guys, that's just about it for today. Good luck with your surgery, and if you ride motorcycles, good riding.
Down to the river, I have held the devil's hand, felt the weight of my own sin, burdened by the heart of man. Down to the river.